but I have chosen my integrity over this fear. I've been a local GP here for the last 16 years, and before that I was educated and worked in Germany. And as a GP, I have learned to look at the science, practice evidence-based medicine, but also, more so when I got older, to keep an open mind and be critical, and not always take guidelines as the only given truth. Because I have learned that science is actually not so clear-cut as you would think. There are lots of different perspectives, and science and knowledge changes. Nowadays, medical doctors are supposed to work within very narrow frameworks, and we are supposed to go along with the narrative. When I look at a complex question and a complex problem, it's always good to go back to the basics. And in this case, I was thinking, okay, let's go back to the Hippocratic Oath that you all know, to see how the statements in the Hippocratic Oath is translating into the current situation. And a more modern version of the Hippocratic Oath is actually the Declaration of Geneva, which has been adapted here in Australia by the Australian Medical Association. And I just want to quickly go through these 10 points with you and see if we doctors and health professionals can in the moment safely practice in accordance to this pledge. So the Declaration of Geneva says, firstly, I solemnly pledge to consecrate my life to the service of humanity. Secondly, I will give to my teachers the respect and gratitude that is their due. Thirdly, I will practice my profession with conscience and dignity. When I came to that part, conscience, I had decided, okay, I'll be here today and give this speech. Fourth, the health of my patient will be my first consideration. And that is my biggest point, really. As a doctor, I'm seeing a human being, a patient, and I'm not seeing the average of 24 million people. No, none of my patient is the average person. I have patients who are newborns, and I have patients who are 90 or older. So there is no blanket treatment that I can apply to all of these patients. When two people come to me and both of them have high blood pressure, one patient might leave the surgery with a script for a blood pressure medication. That could be an 80-year-old patient who just has had a stroke. If I don't give him the medication and he doesn't take it ASAP, he is of serious risk of immediate death. But if I have a 20-year-old walking in with high blood pressure, that person I might diagnose with anxiety, with stress, and that person will leave my surgery with a plan how to address the underlying cause. That patient does not need that medication. And the same applies with vaccination. Looking at evidence and science and evolving evidence, we know that there are people who, on balance, benefit of vaccination. We would love to have really good vaccination, and I'm sure they will get better. But there will be many people who, on balance, don't benefit from the vaccination. So we cannot put a blanket rule on vaccination and say everybody needs to take it.
Yep.
any medication. With cancer treatments, we are well adjusted that patients get involved to choose their treatments, and they can choose to not have a treatment as well. Let's move on. Number 5, I will respect the secrets that are confided in me even after the patient has died. Number 6, I will maintain by all means in my power the honor and the noble traditions of the medical profession. Now, the noble tradition of the medical profession is one of trust. So trust is a big thing between the patient-doctor relationship. And I don't want to jeopardize that trust. I want to give advice based on my best knowledge and on best evidence, which includes that I'm committed to lifelong learning and to re-evaluating emerging evidence. Number 7 of the Declaration of Geneva is my colleagues will be my brothers and my sisters. In the moment, I sometimes struggle to really feel close to these brothers and sisters. But I guess that's like a normal family life as well. Number 8, I will not permit considerations of age, disease or disability, creed, ethnic origin, gender, nationality, political affiliation, race, sexual orientation, social standing, or any other factor to intervene between my duty and my patient. Any other factor in the moment means being vaccinated or not being vaccinated. That should not be an issue between your doctor and yourself as the patient. So we should not allow any segregation based on the vaccination status. Number 9 says, I will maintain the utmost respect for human life, which means if I'm aware of any potential threat of a medical intervention to my patient, I need to inform my patient about it and need to let that patient make his or her choice. And lastly, I will not use my medical knowledge to violate human rights in civil liberties, even under threat. And I think that does not need any further explanation. So, applying these underlying values to the current situation, my appeal is to my medical colleagues to take some time, and I know time is the critical factor there. Try to take some time, step back, and look at the science and the evidence for yourself.